So our next speaker is a little eager. Her life and work defies a 1-minute summary, which is all I have time for. Perhaps more than anyone else I know, with the exception of George, of course. Esther Dyson is the founder of Hiccup, an open source evidence generating project devoted to defining and testing models for producing community health. And its first project is something we're about to hear a lot more about. But Esther also acts as an investor, advisor, and/or director of too many startups to list, including 23andMe and Patients Like Me. She is my wonderful colleague on the board of personalgenomes.org. Most importantly, she is PGP3. And with that, I will give it to her, and I haven't even gotten a chance to talk about her side career as a cosmonaut.
So I feel a bit like someone in Deborah's talk who planned something a week earlier and now has to live with the consequences. So these slides are, my purpose here is to explain to you Hiccup and its project Way to Wellville. There may be some of you who would like to get involved. For the rest of you, I hope it's interesting regardless. It began with the Healthcare X Prize 4 or 5 years ago. That was a brilliant idea that the X Prize was going to do with WellPoint, where they would take 5 populations of probably 20,000 covered lives each and try various medical interventions to see if they could make them dramatically healthier. And then the people with the winning protocols that made the 20,000 people have the best medical results, including lowered costs, would win the prize. Like one of the Genomics X Prizes, this thing never happened, but I kept thinking, what a great idea. Somebody should do this. And about a year ago, I was speaking at a Quantified Self conference, of course. And for a bunch of reasons, I didn't want to talk about 23andMe, so I thought, I'll talk about why somebody should do this Health X Prize. And realized, boy, what a lame talk that would be. Somebody else should do something. So I announced what is now in progress and what I'm going to tell you about today. The first thing I did was I had 4 brainstorms. A guy in a suit showed up and started asking awkward questions about how this thing would work. He is now the CEO, and he took my name, Hiccup, which stands for Health Initiative Coordinating Council, and he called the thing the Way to Wellville, which is Hiccup's first project. And what is it, if I can find this? Here we go. Basically, it's a pseudo-clinical trial. This is your traditional clinical trial, and if you're in the business, you know that only certain things make good clinical trials. They are things that are supposed to become blockbuster drugs that you can patent and make billions off. Or they are very cheap extensions of the life of those drugs that you can make more billions off. You don't have clinical trials of aspirin or most naturally occurring things because they're not worth it. And you also, in a clinical trial, you want tight control, you want to make sure your subjects are carefully vetted, blah, 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 and you need to control what happens. We decided to take a different path because we were trying to do something else. We are basically doing a clinical trial, not of any particular intervention for better health. And I'm thinking of things again like Deborah's healthy eating. It's interesting. She too is not focused on you need this diet or that diet, but simply if you think about it in advance and you make your decisions now for next week, you might well make better decisions. There's so much stuff we know about how to be healthier, about eating, about diet, about exercise, about lack of stress, sleeping more, not sitting on the couch watching Netflix, Albert. And most of these things, they sort of work. If you study them very carefully and you do regression analysis, it's like pouring a pot of coffee into a large swimming pool, or maybe peeing into a 40,000-gallon reservoir. For those who read that sad story, you can probably detect something somewhere, but it dissipates. So what we're trying to do is pour pots of coffee into 5 bathtubs. And see the results so that we can test the proposition that doing a bunch of things together, and yeah, we will take some interest in which things those are, can actually produce not just measurable but visible results that can both inform and inspire people to follow in our steps. And we're going to make it nice and commercial. We're going to try and make it like Albert's last graphic, not like his first one. We're going to have a cheesy reality TV show. We're going to call it Quantified Community instead of Quantified Self. The idea here is not that a nice white lady is going to go to some town in the middle of America and tell a lot of people how to live right. I don't think that would work. We are going to find 5 places that want to do this, that already have some social cohesion, and we're going to help them. We're going to help them meet people like you, whether it's quantified selfers or maybe some of these towns would like to do some genetic analysis, some genotyping. We don't know, and we're not committing them. It's got to be up to them whether they want to do this. But we, personally, obviously, I hope they do. But this is a different part of my life. This is not the genotype part of my life. This is people manipulating themselves because they understand themselves better. And we're going to do this. It's going to last 5 years, 5 places, 5 metrics, 5 years. And then we're going to publicize it like crazy and hope that everybody steals our ideas. So if you're watching carefully, you can see a change in the slides from the ones that I did, which you just saw, to the ones that Rick did, which are much prettier. And I won't go through them in great detail, but just as a little more context, all the stuff that's medical is on the right side. The stuff in the middle is our spending, and the stuff on the left is what actually matters. Most of the outcomes, until you get to the end, aren't due to medical spending. They're due to behavior, to choices people make. But more than that, they're due to the choices people have. Can they walk to school, or are their parents afraid that they're going to get jumped on the way? Can they buy good food easily? Do they have the time to make breakfast, or is it simpler just to buy McDonald's or to pour the chips down? So we're trying to change the places people live so that they can change how they live. And the next slide just shows you all the different factors that are involved. We're going to be testing, as I said, both these non-medical programs, but also asthma prevention programs, diabetes prevention. We're going to have people visiting people out of the clinic. We're going to do all the traditional medical things you hear about, like trying to reduce use of ERs and increase regular doctor visits. In each of these 5 places, we're going to need the medical system to see us as a friend. It's got to be an accountable care organization, obviously not a traditional fee-for-service medical organization that will lose revenue if we're successful. We want them to benefit. Schools, we're going to change school lunches. Probably the most challenging thing we're going to do is go to people like Walmart and Safeway and Walgreens and Chipotle's and McDonald's, all of whom, if you talk to them, number one, they probably don't like their kids doing this stuff themselves. They would like America to be healthier. They don't want to kill their customers, but they've got quarterly earnings, they've got budgets, they've got competition. But each of those companies also has test kitchens and little secret projects because many of them know Armageddon is coming in some form or another. And our offer to them is we want to give you 5 test markets, 5 demilitarized zones where you can try out your healthy menus, your marketing approach, not necessarily marketing the food as healthy, but marketing healthy food as fun. So the criteria, and just to go to sort of practical things, we are now running an application process we're looking for these 5 communities. They have to fill in a huge amount of information, most of which isn't necessary in the first round, but we're trying to scare off the faint-hearted. This is not have a running club, do the marathon, and win a prize. This is commit to 5 years of raising money, running programs, redoing your community, getting your mayor and your school board, we know about that in New York City, getting your mayor and your school board to work together, your city council, your churches, your YMCA, and doing this together so that there's a legal entity that if there is a prize at the end, they can actually receive it and use it. They have to be under 100,000 people and self-contained, i.e. not a suburb, because we want the data. The data's going to be messy enough anyway, but we want people at least staying in the same place, not going out to eat lunch, and not moving in and out of the town or county or small collection of towns too much. We won't be frisking them at the border for French fries, but we really do want them living inside the place in order to generate better data. And finally, so here's our timeline. We have to select the 5 communities this summer. In September, we're going to have a kind of, sort of like this, a sort of trade show cum conference with the communities there, 5 community leaders from each community or something like that on behalf of the entire community, hearing about what kinds of programs they could bring to their town, talking maybe to some of you about particular, not just tests, but actual interventions that they could try. And it may be in one town you'll have half the people with Fitbits, half the people won't, or half the people would do one thing or another, and we encourage them to change while keeping careful records if they think something is working or not working. In other words, we're not trying to construct a different life for people, and in that way it's very much not like a clinical trial. We're trying to see what happens out in the real world where people are dealing with kids coming home from school, and we suspect at least one mayor will be replaced during the course of the 5 years, so we need to figure out political things. I'm going to go to questions, but I have to tell you, already in the first year, I have learned so much. And it is so interesting and fun and exciting and completely different from a lot of what we were talking about here today. But in the end, these are the people that those of you who have a mission are mostly ultimately going to try to reach. So with that, I'd like to do some questions. Thank you. Do you want to do them, or how does this work?
Yeah, so microphones are coming up.
Great. For Dan.
It's a small switch.
Oh,
I'll repeat it if you want. Yeah, just go
If
ahead.
you go to an urban neighborhood, such as
Yeah.
West Philadelphia
Yeah.
or something.
Could I go to an urban neighborhood such as West Philadelphia? Not for our purposes, because again, the people in West Philadelphia just move in and out too much, and so we can't get grocery receipts from the grocery stores to cover them, and we are not expecting to get everybody to monitor themselves. Again, you saw, I think it was Albert's chart, 10% of people will do that for you, but they are not a random sample. So what we're looking for is a place where the people don't move around too much. And so they are not necessarily representative of everybody, but they will be representative of what happens if you can make these things work. And so they will provide a huge amount of information and inspiration. And then it's up to the next project to figure out how to generalize that for neighborhoods and urban settings.
Ryan?
Ryan?
Esther, this is so great what you're trying to do. I was wondering, not to make you speak about somebody else's slide, but I think it was Albert who showed, or somebody showed the 10% is going to be
Yeah.
motivated by data. That big number was at 60 to 70%. They're motivated by something else. in this year of thinking about how you're going to motivate people for healthy living, what do you think is that 60 to 70% about?
Some of it is, I mean, some of it is what's happened. So some of it's what their friends are doing. Some of it is taking away the necessity for convenience, taking away the price signals that tell you McDonald's is cheap. I mean, so we're going to be not just doing some of this marketing stuff. We're, at least in some places, and we're looking for donors, we're going to be subsidizing healthy food. We're also going to be putting the healthy stuff at the back of the store. I mean, so this whole thing is being constructed as you watch. We haven't got all the answers. We have what we would really, really like to do, what we hope we can manage to do. We want people to understand how they're being manipulated by advertising. I mean, how do people get the way they are? Through advertising, through what their friends did, through an obsession with convenience, through too many cars. One of the best statistics in the US right now is how much less young people are driving. As a non-driver, I'm already part of that cult. But so we're going to try and change some of those much more subtle influences back, and we're hoping to discover more. There are things. It's what you see on TV, and we're not going to control what's on TV, but local television could be very important, and local television is a great medium for doing interesting things and for getting people involved. And again, one huge social factor now is people's desire to be famous. And with our reality TV show, we can make people with healthy behavior, we're going to have all these little mini contests and subset trials and so forth. We're going to make a lot of people famous for some better things. And if anybody has ideas, we're willing. And you can go to the site, which is hiccup.co, hiccup.co, and you can find out about the contest and the conference and so forth. And the question in the back?
Hi, Juan Rodriguez, Weill Cornell. So I think in terms of you having 5 different communities, you have an opportunity to look at different types of communities. So I think maybe if you just looked at 5 rural communities, you will get one result, but I think it's more interesting if you did incorporate at least one urban, one suburban, and one rural, right? And then you could revolve, it doesn't have to revolve around just one town. It could revolve around, let's say, a school or a community, so that, because I mean, there's a large percentage of the population that will be in an urban setting, and maybe in an urban setting, the modifications are going to be completely different than in a rural setting. So you run the risk of your findings not being applicable to a large percentage of the population of the country.
You are right, and we've thought about this a lot, and my answer is 95% no. It's more important to get better data. We may, depending on who signs up and their level of cohesiveness and a couple of other things, we may change our minds. But as I said earlier, we're not trying to mirror the population of the US. We are looking for diversity, and we're certainly looking for everywhere from the island of Kauai in Hawaii to someplace in Maine to Tecumseh, Michigan, Western Pennsylvania. We want a diversity of places, but at the same time, we simply don't think that we can be successful with limited resources in a neighborhood of a much larger city. If someone persuades us that we can, then we'll do it. And we may end up creating shadow hiccup communities that do try to do it, that are, we're open. But the ability to collect data without necessarily tracking every individual, I think, is very important for what we're trying to do. And again, someone else, we would love to see someone else do this in West Baltimore. And if they do, we will invite them in, we'll celebrate them, but we're not sure it's going to work as well as what we're trying to do. But come argue with us.
Any other questions for Esther?
Thank you.
Oh, one more. Cliff?
going back to the talk on sports and genomics, I tell my patients all the time that weight is sort of hardwired in, where our ancestors had to run down their food and they had to live off it for a couple days, and they stored it weight as fat. And now in our society, we can walk in the kitchen and get all that stuff we're hardwired into, the salt, the sugar, the fat, and we don't get the exercise. So a lot of this is genes. I don't know how modifiable it is until we figure out what causes these.
Yeah, but we didn't have the rate of diabetes even 40 years ago. And yes and no. We have changed to where we are. We can change back to some of what we used to be, is the proposition. I mean, maybe after 5 years, I'll just have to go commit suicide. But, it's just, I don't think it's fair to go say, everybody should be like me and buy a Fitbit. I think maybe you can change the environment they live in that keeps sending them the signals that tempts them. This is a world where you're continually being tempted and tantalized to, I don't think advertisers, I'm on the board of an advertising company, I don't think advertisers are the devil. But I do think it's time for people to understand how they're manipulated and maybe to collectively manipulate themselves in another direction. And one reason we're looking for small places, at least to start, is so that reverse manipulation is perceived as collective action and not government interference. But just wait. Thank you.